Hello. Today we're going to talk for the next 30 minutes or so on recognizing fluid and free fluid when you're using an ultrasound machine. This is really one of the key functions of ultrasound because ultrasound tells the different sorts of fluid apart very well, particularly when you compare it to the more static measures such as CT. Now, fluid is defined as something that has no fixed shape and submits easily to pressure. And these are two really important characteristics that we'll use over and over again when we put the ultrasound machine on. Now, when we first teach point of care ultrasound, we often tell you that free fluid is black. In fact, we need to set our monitor so that the fluid in the bladder is black, and therefore anything else that's as black as the bladder we consider is probably free fluid. Obviously, if you haven't got any bladder on your screen, you can use the gallbladder or even perhaps the blood in the heart. But this is the first way that we teach people to recognize free fluid. But unfortunately, this isn't quite enough, and sometimes people disobey this rule. Another thing you need to think about fluid is that it'll sit around things if it's free, or within things it will conform to the shape of the container. And so, as we have the picture on the left, that is contained or constrained or bounded fluid. And on the right, we have fluid that's sitting around things, conforming to the shape of outside. Here you can see already a very little slip of free fluid between loops of bowels. And this is a very characteristic shape with sort of pointy edges and concave sides. Another thing about free fluid is that it obeys gravity, so it will work its way down to the lowest portion of the cavity, if it can. Another thing about fluid is that we can, to some degree, quantify it. It's pretty hard to actually give measures or volumes with free fluid, but we can make estimates of a large amount or small amount. Another thing about free fluid or any fluid is that it yields easily to pressure. And so as you can see here, we have a loop of bowel floating very freely in some free fluid. And as you watch how gently it undulates side to side, you can guess that the fluid it's sitting in is not viscid or thick. It's probably a thin transudate. Also, free fluid can allow movement of particles within it, and what's more, because the fluid is easily deformed, the particles move asynchronously with the pressure, and so if you shove or push or squirt bubbles in, the free fluid will respond after a moment with movement. So, let's go back over what we think of fluid. It's usually very dark. It usually sits around things if it's free fluid or within things if it's bounded. It obeys gravity, so it will sink to the lowest part. It is to a degree measurable. It should allow movement within it, so things that move or deform your fluid space are able to do so easily. But also if there are particles or bubbles floating around within it, they can float freely. So, the next thing we have to do is look at a pile of slides and get your eye calibrated to think to yourself, is it fluid? And then secondly, is it free fluid? It's much harder with a still picture, but going by the shape of this is most likely to be bounded fluid. Fluid encapsulated often has some sort of visible capsule that you'll see at least at the leading edges rather than the sides. This, by the way, is an aortic aneurysm. Take a look at this one. We've got pericardial effusion. The fluid is going right down to the bottom of the screen here where the pericardium is bounded. We also have a fine tremulous movement of the fat pads within the fluid, suggesting that's a thin fluid. Then we have the bounded fluid. We've got the blood within the heart. Contrast it with this one. This is the left side of the chest and abdomen. We've got a nice big spleen. We've got a diaphragm that's doing its best to move. A little bit of fluid under the diaphragm and a little bit here above the diaphragm. But as you can see, we have all these loculations between collapsed lung and the diaphragm, so nothing's moving very well at all. Technically, I think you might call this free fluid, but it's not something you'd put a fine needle in to aspirate. Here's another one of the base of another lung. We can see, and one of the best things about fluid is that you can see through it very well. It acts a bit like a microscope. And we can see that the diaphragm on the screen right actually isn't moving very well, not moving like a diaphragm should. We can see some sort of echogenic fibrinous mass at the bottom right of the screen, which really appears to be waving freely in a dark fluid. And if you look very carefully at that dark fluid, you'd probably notice some tiny speckles floating around within it. This is an adenocarcinoma, the back of someone's chest. And because there's a fluid in the chest, you can even see the spine at the back, the spine side. Here's another one. This is Suprapubic Transverse, and we can see a large round mass. You'd be forgiven for thinking that might be bladder, but the wall's too thin. But if you look underneath it, you'll also see what looks like tiny triangles of fluid on the right and the left, which is the fluid from another part of the cyst that's ruptured out. So here we've got both contained fluid and free fluid. This is a nice picture. This is right upper quadrant longitudinal from the side. So we have the liver on the left. You'll notice that the liver has a tiny dark cyst in it that's bounded. Notice how that dark cyst has a bright flare underneath it, what we call post-cystic enhancement or posterior enhancement. Then we've got the black fluid in the gallbladder on the right. That's bounded fluid. Go by the shape of it and the good capsule you've got. Then in between the liver and the gallbladder, we've got the dependent, obeying gravity, allowing free movement. In fact, this fluid obeys just about every rule except the first. It's not black. It's not as black as the gallbladder. So like I say, although we may have 6 or so different criteria for free fluid, everyone's allowed to disobey at least one rule. Here's another one. This is the base of the right lung. It's beautifully how we can actually see the descending thoracic aorta. It's a rare sighting going across the bottom of the screen. The diaphragm's on the right, but as you can see, there's a web-like echogenic structure in the middle. This is, that was chronic hemothorax with some organization. This is a suprapubic view longitudinally. We can see the symphysis pubis on the far upper right. What do you think? We've got bladder way over here on the screen right. We've got little loops of bowel moving fairly freely on the screen left. We have some dark fluid in the middle that appears to be tracking down, down, down. But have a look at this interesting isoechoic mass in the middle. It doesn't appear to be bounded. If you look very closely, you'll, I think, see that it has a little bit of its own independent movement. What we have here is blood clotting in the base of the hemoperitoneum, obeying gravity to a degree, but not obeying that rule of black fluid. Even more so in this case, this is another suprapubic long view in a young woman. We have the symphysis pubis on the screen right and the bladder underneath it. Underneath the bladder is the vaginal stripe and the rectal gas shadow. This here is the uterus with the cervix, some edge artifact. Isn't it scary, the other masses we have in here? Normally, the back of the uterus is bounded by bowel gas, but instead, this time, we can see right down deep here to what looks like a dark collection of some sort. In fact, these are the areas here, if you may not be familiar with suprapubic views, but they're quite unusual, this mid-grey. What we're actually seeing here is a ruptured ectopic, and this is another hemoperitoneum with some fluid blood collecting at the bottom and clotted blood around the uterus. So it does get hard, doesn't it? Sometimes one view is not enough and you have to look further afield. Particularly with ectopics, you go and look in the right upper quadrant and the left upper quadrant, because if you have fluid, as you do here, between the kidney and the liver, then you'll know you've got quite a lot of bleeding. This patient had more than 1.5 liters of fluid in her abdomen. Now what about this one? This is in fact the proximal tibia of a young child, and the area that we're pointing to is in fact the epiphysis of the tibia. Now, one thing I must warn you about is that cartilage is also black. A very useful thing about cartilage, though, is we can usually compare it to the other side. Just underneath we have the ossification center, and this is the metaphysis of the tibia. So, looking at this is all cartilage. This is not fluid. It's a bit scary because I have seen people try to aspirate this. Now I've put the straight probe down on an area of red skin. Obviously we're looking to see if it's just cellulitis or whether there's a collection. From the very top we have the skin, we have the subcutaneous tissue. These sort of white bits here are in fact inflamed fat, and the more inflamed they become, the brighter they become, and then they develop what almost looks like septations or dark cobblestoning of edema or lymphatics. Under here we're getting some sort of collection happening, but I wouldn't like to call it an abscess until I tested it by pushing on it to see if there was any independent movement. Underneath this area we have the deep fascia, and underneath the deep fascia we have muscle fibrils. Very important thing to get used to searching if you're at all concerned about neck fascia. This one's a surprise. Aha! This is, believe it or not, the head of the humerus, the arms being internally and externally rotated. The teres major or minor, can't remember which, is pulling the head of the humerus. And this is a very interesting picture. It shows you this little bit of independent movement, in fact, of bubbles within the glenoid cavity, within the joint of the shoulder. We often have trivial bubbles in some of our joints. But note the movement, note how it responds, but responds after the head of the humerus rolls. Ooh, this is an easy one. This is the base of someone's lung. Again, diaphragm on the right, spine sign near the base, and that beautiful moving sliver of collapsed lung in the middle, moving quite autonomously, it seems. Well, not really, but it seems like it. Yes. What do you think is this one? This is actually an elbow joint just above the head of the radius. Can you see in the middle we have an area that's got pointy edges, although it does seem to be bounded, but it has its own independent movement underneath. It's responding to the pressure. This is a hemarthrosis, an early one, a fresh one, hasn't clotted yet. Here's again an area of fluid above the spleen, and we have a fairly freely moving, waving tether between the spleen and the abdominal cavity, possibly a remnant of hematoma or fibrinous organization. Note how free fluid in the abdomen abuts the solid organs without any sort of bright edge or capsule. It's a very important thing to get used to, because fluid that's encapsulated often has a bright edge around it. Watch very carefully in here, and we'll see some very faint echoes moving or swirling within this globe. And see how they follow the movement, a bit like clothes in a washing machine move just a moment after the tumbler moves. This is vitreous detachment, or at the back of an eye, and what you're seeing is the eye moving side to side. You often have to put the gain up high on a black fluid collection if you want to see these fine sparkles. But don't leave it up too long. So what do we have here? Suprapubic long again. We have, can you see it? Some small tongues of free fluid here and here. And in fact, they're outlining a clot that's coming from the cervix. So this is a large vaginal clot, a little bit of free fluid either side. Now this is a good example of an alternative. This is the right upper quadrant. You can see the kidney on the right and a little bit of spleen on the liver on the left. And you can see what looks like tongues of fluid between the kidney and the liver. But I want you to look very carefully at the edge of the liver here. It does appear to have a white outline, doesn't it? So this isn't technically free fluid. This is fluid that's bounded or encapsulated, in this case in the perinephric space and in the perinephric fat. So yes, we'd call it perhaps a collection. The CT reported it as significant perinephric stranding, but technically it's not actually free fluid. And the fatty area between the kidney and the liver can look quite dark at times and be quite similar to free fluid. So watch very carefully for this. Do we have this bright strip, slightly brighter strip, between the fluid and the liver or the spleen? Now, this one is a subcostal view of the heart. The tricky question is there a pericardial effusion? And the answer is yes, but it's tiny and probably physiological. In fact, you can see it slip in and out just here as the patient breathes. Physiological effusion is one that disappears in diastole, so I think we'll probably call this one physiological. But you'll notice that there is a large fluid collection anteriorly. Well, it seems to you that it's anterior to the heart, certainly superficial to the heart, but this is because we're beaming the ultrasound up from the epigastrium. We're actually passing through quite a bit of ascites before we get to the pericardium. The reason we know this is ascites is it has a real classic hallmark, which is this falciform ligament. So don't be trapped by thinking a large ascites is a pericardial effusion. When you see something like this, immediately look to the posterior or the deep margin of the heart to see if the fluid is going all the way around. And this is another view of the right upper quadrant, but this time we're looking near the lower pole of the kidney and the lowermost extent of the liver. Can you see we've got a small area of dark fluid in here as well? And see how it doesn't appear to have any bright edge to it, just the distinct edge of the liver. Again, this is free fluid from a liver laceration, but in this case it's only a very small amount. Here's a tiny bit of fluid at the lower pole of the spleen. We argue a little bit about where free fluid first collects in the left upper quadrant. Some people say here at the lowermost pole of the spleen, and other people say it tracks here to the region between the spleen and the diaphragm. But none of us argue that it comes down here between the kidney and the spleen, because this area is out of bounds. It's essentially fenced off by the splenorenal ligament. So even though this is where we'd be looking for free fluid in the right upper quadrant, we don't look here in the left upper quadrant. We look at the lower tip of the spleen and we look in the splenophrenic recess. Now this is using a straight probe, so we're seeing a lot more clearly. We're looking again at the base of someone's lung. The strip on the side here is in fact diaphragm. Beautiful view. A little bit of what looks like tethered lung. It's abnormal. It shouldn't have this amount of icicles hanging off it. It shouldn't be stuck to the diaphragm as it is. But here we have a strip of what appears to be very likely free fluid, pointy edges dark and allowing free movement. A small pleural effusion, essentially. This one is, I don't know where, I think in someone's abdomen. And what I want you to note specifically is that very faint swirling. I think Lichtenstein calls this the plankton sign when he's referring to lung effusions, as if tiny particles are swirling by themselves within the fluid. No prizes for this one. Hearts are always easy to identify when they're beating. As you can see, this pericardial effusion isn't black, which is very concerning. We're concerned that it's a hemopericardium. And the most important thing about this view is that you can actually see through the hemopericardium the way the right ventricle and the right atrium are moving. Some people have described this as two little men bouncing desynchronously on a trampoline. We see the right ventricle going down at a different time to the right atrium. And this is very, very concerning for pericardial tamponade. In fact, that's what happened. So when you do have free fluid, take the time to look through it and see how things are behaving on the other side. I'm just throwing you all these pictures randomly because I want you to calibrate your brain. What do you think about this strip of fluid? That's just underneath the lower pole of the liver. I told you that's an important place to look. But what do you think about a boundary? It certainly does have a boundary. I mean, this is in fact a small gallbladder. And many people early in their career will mistake the black of a gallbladder for free fluid between the liver and the kidney. If you see fluid like this, you need to play with it. You need to look at it from another angle and see if any of it tracks over the upper margin of the liver. Here is, for example, normal liver kidney. On the right-hand side, we expect the fluid to come down to around here. But we never expect fluid under the upper pole or the lower pole. Not free fluid anyway. If we see fluid at the upper pole or the lower pole, we have to worry about retroperitoneal fluid, which technically is not something we called free fluid in the past. What about this? Isn't it nice that you can see the movement? Bounded or unbounded, would you think? This is actually normal peristalsis in small bowel. Perhaps there's a bit extra fluid in this loop of small bowel. If I saw something like this, I'd want to look further around and see just how many loops of bowel seem to be a little distended. Oh, this one's not moving. This is a left upper quadrant, and we're looking here to see if there's any free fluid. Now, I must warn you, a full stomach will occupy this area here and has often been mistaken for free fluid again. So be wary when you're in the left upper quadrant. Find the kidney, find the spleen, and don't get distracted by a very large fluid down here. This is not where free fluid collects. Oh, that's another one to give you a break. It's bounded, isn't it? So probably not free fluid. Can't even guarantee that it's fluid on a still. This is an interesting one, isn't it? Certainly looks like fluid. It has free movement within it and particles. Not particularly obeying gravity, though. Although it doesn't seem to be bounded, perhaps. This is actually a fluid collection in a patient who'd had an anastomotic leak. In fact, you can even see a little bit of gas at the top of the collection here, and a loop of bowel underneath. This is another picture, I think, from the same patient. Once you have a little bit of fluid, even in the mesentery, it can make the wall of bowel stand out more clearly. I'm not sure you'd call this amount of fluid free fluid. It might perhaps just be fat stranding or edematous walls, edematous mesentery. This one, this is another collection, a bounded collection. It's actually a hematoma in the sheath of the rectus abdominis, courtesy of all those Clexane injections we get. And this one in the left lower quadrant, again, see how the fluid outlines the bowel and makes it far more easy to see. It's got pointy edges. Would certainly be called fat stranding, flare in CT scanning. Whether you actually call it free fluid, I'm not sure. Oh, look at this one. This is again a liver from the sagittal view, right upper quadrant. Very nice dark round strip here. Free fluid, do you think? This is not the gallbladder. Notice how it's got a very bright white edge, and here. In fact, I think this lowermost edge is acting like a specular reflector, and this dark strip here, I'm pretty sure, is simply a reflection artifact of the gallbladder above. This is very tricky, and it's another one of those cases where you absolutely must get another view from another angle. Suprapubic long, is this free fluid here? Certainly fluid, but this is bladder. This side we've got uterus. Here we have the gestational sac, possibly a little perisac hematoma. Free fluid in this picture, abdominal fluid, would be back here behind the uterus, obeying gravity. What do you think about this area? This is left mid-axillary line, sagittal type view. Is it sagittal? Coronal view, sorry. This area here, it's pointy, convex edges, dark. Yes. This is actually hydronephrosis, and this around here is the cortex of the kidney. I often talk about this being like broccoli, and if you can actually see the trunk, the stem of the broccoli, you've got hydronephrosis. This one, bounded fluid again, constrained fluid, even appears to have a capsule. This is bladder, I think. Ooh, this is a tricky one. I think we have a portion of liver in the left upper part of the screen. Look at the whiteness underneath the edge of the liver. Looks like it's moving freely. This area here, however, I think is actually a reflection of the liver above it. It's reflecting off this really bright surface here. What we actually have is free gas under the liver. And as the patient breathes, the gas is moving in and out of the lesser sac. So let's recap. We're talking about at least 6 characteristics of fluid and a couple more that may decide whether they're free fluid or not. Remember, fluid itself doesn't have any shape. It conforms to the shape of the container. Secondly, it responds easily to deformation. So for me, first of all, I look for black bits. But if they're not black, it doesn't entirely rule out free fluid. I look to see if they obey gravity, if they conform to the shape, whether it's the inside shape or the outside shape of the container. I look to see if there's any independent movement of particles within, movement that's dissynchronous with the deforming force. And I look to see that other things can move freely within them. Bowel, I look to see what is beneath or beyond them. How is the diaphragm moving? All these things are really useful things to look for when you're looking at an ultrasound, because deciding whether fluid is in the right place or not is a very large part of what we do with ultrasound.